So yeah, so I just got it recorded now. So I'm Leslie Cornwell. I'm holding the camera in the back. I'm the one that runs Ultrasound Trainings. And Crystal was so gracious. She's the nurse midwife attending our November workshop. And Catherine is our very experienced instructor. And so we thought we had a little time before lunch that I wanted to do an informal discussion because we were talking about a lot of great things, especially because Crystal's an experienced midwife and we talk often about the scope and what the average midwife gets trained. I wanted to pull the camera up because you were talking about how you found this and what your goals were, so I'll let you introduce yourself, Crystal.
So, Crystal, I've been a midwife for 7 years, was a labor nurse before that, have been on the job training for ultrasound, like, you know, just my doctor has taught me how to do it. I've learned and, you know, even gotten some things that, like, you were teaching me, like, that just came to me, like finding the head, then finding the abdomen. Like some of those things, I think when you do it, you just automatically do because they're easier. But I wanted, even though I know how to do ultrasounds, I've done AFIs, I do crown rump links all the time, I estimate fetal weights, and I feel like I've been pretty close with those when I've had babies born, you know, right after that. I knew that I wasn't getting everything proper. Like, you know, like the stomach bubble you need and the umbilical vein, like I knew that I could be better at what I was doing, be more precise, avoid interventions for patients. Like if I say the baby's small and then I induce them early, like, and then the baby's 7 pounds, like, isn't that horrid?
Yeah.
So I wanted to make sure that I'm doing the best. And even though I already kind of know what I'm doing,
You're definitely at a more advanced student. Our last couple of students that have been more one-on-one individual are more advanced. But the average student we're having, 80% of them are under 2 years out of practice. They didn't get in school. They now are past that new baby green step and they want to grow more. So
yeah, but I mean, even, okay, so that's really good for people who don't know what they're doing, for sure. But like, even though I know what I'm doing, kind of, like, why not always be better?
Yeah.
So, like,
the precise calibrations, the terminology, the exact...
Getting a cervical length, I mean, that's, like, insane. Like, finding that cervix is not something that you can just probably do on your own without someone teaching you, like, how to do it.
Yeah.
So, being able to hone your skills and be more precise, more accurate is only going to help your patients to have better care. Like, so at the end of the day, what are we in it for is like good patient care.
Yeah, and you even work at a private office with a doctor and he taught you a lot, but there's still so much with just being one-on-one with Catherine, and we talk a lot. Practicing on patients when they have a concern and a complaint is we're rushed, we're anxious, are we really seeing it? This is a safe, neutral place. These ladies are coming in volunteering for specifically you to practice and take your time and ask silly questions versus you have a relationship established and they're like, how qualified are you? Like if your question, so it's a different atmosphere. We wanted a safe space for nurse practitioners and midwives to train.
Well, and then because, okay, so like if I was doing an ultrasound with John, I like work with him all the time. Like you might be less apt to ask a question that you feel silly or dumb about to someone who expects that you know stuff. Like Catherine is coming into it expecting that I would know nothing. Yeah. Okay. Or even if I know something, that it's probably not the exact thing. And so then it's nice because I can say, well, okay, like, but is it this and this? And I can say, like, let me look for this first and let me tell you what I think. Am I thinking the right thing? Exactly. Like, would I do it here to here? And she's like, yes. Yep. And so it's, then you can practice like I don't want to say guessing on it, educated guessing and like figuring it out. And then she can validate like what you're seeing.
Yep. And that's what our hope is to have midwives, nurse practitioners come in and we ask them where
customization,
what your hopes are, what your goals are, and we customize where you're coming in at.
Yep.
So it's a great personalized training, and you're getting wonderful hands-on, and we have
but exercise before you come because there's a lot of muscles that you use that you didn't know.
When you're a little more one-on-one, it's constant, but when there's a group, you get a little break and you watch other people. So, but yeah, even our group sessions are 4 to 5 typically, and you get a nice rotation. We have 8 to 12 volunteers throughout pregnancy, GYN. You can practice on each other, working towards the simulators. Like, there's just a lot of potential.
And you group people like based on experience. So exactly. Don't worry, like, if you have more experience, you're not going to be grouped with someone. Hopefully,
the best of the ability.
takeaway
yes,
experience the best you can, so that
Yeah.
that way you're
There's a
kinda-
reason I ask all those questions on the registration paperwork. So when we have workshops where we have 4 or 5 stations at once, you get the newbies together, and then you get the instructor that's maybe newer on our team versus, hey, you've been doing this for, as a midwife, a very long time. You want precise. We group together that has someone that is an instructor that has that specialty. So yeah, we really work hard to customize and do evals and feedback. But yeah, Crystal, I'd love to hear, this is the last day of 3 days for you. How you feeling?
Good. Like, I feel like coming into it, like I wasn't, it's that like small hand movements moving it. So like today everything's like clicking into, okay, just rotate it this way or push a little pressure this way or whatever, and being able to like get them in the right thing. So it's gotten easier each day to see, because repetition of seeing something today, you know, the first day seeing it and then thinking about it that evening, coming back and seeing it again. Like, I think the 3 days is really good, because then you get to like rest on it and think about it and come back and look again. And so every day it's gotten easier.
Yep. We have days 1 through 3, just because the 3 days, the first time we're testing it this fall, because a lot of people would say, the 1 is, it's rare we get people with the 1 because it's more for the green people, just wanted introductory. Most people tend to do the 2-day, but I like the 3-day because if people are really wanting to hone in, repetition is always better. If you can get off the time, you can afford to have that extra. 3 is always better because your skill. I mean, our evaluations show where people are like, I kind of feel good because I just saw it once, and then once you see it 3, 5, 7 times, you're like, yeah, I feel really comfortable when you leave.
Yeah,
it's actually that repetitive way to do everything, and makes it more easy.
Right, yeah. Like today finally, then yesterday a little bit, and then today even more. I'm like, okay, I think this is the cervix. And she's like, yes, that is. And I'm like, okay, I'm finally seeing shades of gray, like which
the image recognition versus the deer in the headlight look. I always giggle when I'm the volunteer and watching the faces, but it gets better day by day, like knowing you're not just seeing gray and white blobs, you can actually recognize things that are being pointed at.
Right, and having the affirmation too.
Yeah. Like, okay, yes, this is the right thing I'm looking for.
Yes, exactly.
Yeah,
and you're doing a great job.
Yeah. But no, I appreciate you doing just a short testimonial, because I hear a lot of people, they're like, I just don't know. I do it on my own. I've self-taught myself, and we just don't know what we don't know. And especially ultrasound is getting more and more popular at the bedside and condensing. And if you can, like we even talked, you can give a totally different education to the patients at the bedside with the point of care versus sending them to an ultrasound tech and the time. You gave an example of a triage lady that comes in, and you'd have shortened the cervix, and you want to feel confident with that length. They don't have to wait hours and hours in triage at additional cost. You have a lot of Amish Mennonites you serve. Like, there's a lot of value to midwives doing point of care ultrasounds. So.
Well, and patients appreciate, I think, like if their provider can do something more, you trust your provider the most. So if you know that you can give accurate ultrasounds, you know, so you're doing the accurate thing, because at the end of the day, you need to be like, whatever you're doing, you want it to be accurate. So like, I have been doing ultrasounds, but have I been the most accurate? Potentially not, because I wasn't getting that precise measurement like we need. And you know, millimeters, centimeters can make a big difference in gestational age and estimated fetal weight. And so at the end of the day, like, you want to be the most accurate because that's the best for your patients. But patients prefer something that is easier. So if you can do it in your office with you, more personal, so that's with you again. Business side, you can charge for it, and the hospital's not getting the radiology department is not getting the cost of that. You're bringing that into your facility. I mean, I think it's beneficial for everyone to be better at it. Yeah,
I would agree with that.
Well, thank you so much, and I appreciate both of you doing just this short testimonial, and we'll go have some lunch.
Yeah. Thanks, Leslie.